Hello, and welcome back to Autistic After Hours. I'm your host, Ashra, and today we're going to be talking about 4 common therapies that are often used to support autistic clients. And specifically, we're going to be talking about why none of these 4 are actually that helpful or specifically designed for autistic adults and for autistic children as well. But of course, here on Autistic After Hours, the focus is on adults. Before we get into the episode, quick reminder to follow Autistic After Hours on Instagram. That's where I post content, reels every single week. It's also where I post polls every Monday so that you can vote for episode topics. Also, special thank you to those of you who are watching me on YouTube. As a reminder, you can watch all Autistic After Hours podcast episodes on YouTube. As a gentle reminder, I am not an expert, I am not a professional, and I am not a researcher. So if I say anything wrong, if I interpret something incorrectly, just know that I'm trying my best, but I am subject to errors, to interpreting things subjectively, sometimes wrongly, because I am a human, just like anybody else. There may be errors with how I interpret it or present it, but I am trying to be as unbiased and as factual as possible. The 4 different therapeutic supports that we're going to be talking about today are applied behavior analysis, cognitive behavioral therapy, occupational or sensory-based therapy, and dialectical behavioral therapy. These are 4 different therapies that are often used when it comes to supporting autistic individuals, but as you'll see in the episode, a lot of them are not as supportive of autistic people as they would claim they probably are. The only one of these that was specifically designed with autistic people in mind was ABA, or applied behavior analysis, but CBT, occupational therapy, and dialectical behavioral therapy were all designed for more broadly supporting people with varying difficulties, but they are therapies that are commonly used with autistic people. And for the purposes of this episode, we are specifically going to be looking at the cons of these therapies. We're going to be looking at why they are not super supportive or specifically designed or helpful for autistic adults. But just know that there are many ways that these therapies can be and are powerful and useful in supporting autistic people. The main point is that none of these are designed specifically to be neurodiversity-affirming for autistic adults. So let's go through them and talk about why this is. First, let's start with ABA, or applied behavior analysis. Now, this is a type of therapy. It's a behaviorist therapy that uses reinforcement to shape observable behaviors. It's very widely used, especially when it comes to people going through insurance. It's often like the first thing that the insurance company will recommend for autistic people. And it's very, very commonly used for autistic kids. It is used with autistic adults as well, but the biggest population that is utilizing ABA is probably autistic children. Now, in my experience, ABA is usually a practice where the ABA therapist will meet with the client, the autistic person, usually the autistic kid, and observe their behaviors. And maybe the parents will chime in, maybe they'll talk with teachers, with other people in that person's life, and try to learn what behaviors people want to get rid of and what behaviors they want to increase and add in. The main issue with ABA is often that the person that's receiving the therapy doesn't have a say in what's happening and doesn't have a choice in how they're being treated. There are ways to administer ABA therapy in an affirming way, but unfortunately, it often is not. Because of that, with ABA therapy, there is potential for a lot of trauma and lasting harm to be done. Many people self-report PTSD-like symptoms after receiving ABA, and many people report having wished that they did not receive ABA because of how traumatizing it was for them. Many times, the parents will be telling the therapist, the autistic kid is doing this thing and we don't want them to do this anymore. And the ABA therapist will try and reinforce certain treats or certain prizes in order to get the child to do a different behavior. So for example, if a child is hitting themselves in the head as a form of self-regulation and stimming, and we want to instead direct the child to engage in a non-harmful stim. Let's say it is playing with Play-Doh. They might redirect the child to use the Play-Doh instead of hitting their head, and then when the child does use Play-Doh, they may receive a prize. Maybe they really like pretzels, maybe they receive a pretzel. And as you can see, this sounds awfully similar to how you would train an animal. And for that reason, a lot of people just largely do not like ABA because of how similar it seems to how you would train some animal who doesn't have a choice in what's happening. And this is a very nuanced conversation because there are many ways that ABA therapy is extremely helpful and necessary for autistic people. There are certain times where ABA may be used to prevent somebody from engaging in very unsafe behaviors. It may prevent somebody from getting themselves into really dangerous situations, and ABA can provide a lot of really important life skills for a person to engage meaningfully in their environment, to be able to have more relationships. And so ABA as a whole is not necessarily this horrible thing. It's that a lot of times the way that it's administered is trauma-inducing. A lot of times the ways that it's administered is not affirming and does not center on the person receiving the therapy as having autonomy. Rather, it takes away their autonomy. So ABA as a whole is not necessarily this horrible thing that needs to be gotten rid of, because it can be very important for a lot of people. But the problem is that the way it's administered is often not helpful / harmful. Another big issue that a lot of people have with ABA is that some people believe it normalizes or reinforces masking, essentially teaching the person to engage in masking, trying to teach the person to be as neurotypical as possible, rather than affirming who they are and just giving them more skills to live their life as an autistic person. Oftentimes in ABA, when it's being conducted in a non-neurodiversity-affirming way, the focus is on reducing autistic behaviors, and the focus should really be on supporting the person in whatever way they need, rather than let's make this person as non-autistic as possible so that they can fit better into society. And again, not all ABA is that way, but a lot of it is. As I mentioned before, another big critique is that with ABA, the goals are set by other people, not by the person themselves. And if it's a kid, then of course there may be some support needed in developing goals for that person if they are too young to be able to come up with goals, or if they have very, very high support needs and maybe they are not able to communicate to you their goals, or maybe they don't really have any that you can tell, then maybe outside intervention is needed to come up with goals. But even in situations where the person is able to communicate their own desires, their own wants, even when the person is old enough and mature enough to be able to be a part of that conversation, often in ABA, the goals are decided for the person and it removes autonomy. Another issue with ABA is that there's very weak adult outcome evidence, aka most of the studies, most of the research is done with kids. And so when it's used with adults, there's not that much research backing, oh yeah, this is going to be really helpful or this is going to be really supportive, because most of the research is focused on children, just like most of all autism research. Another issue with ABA is that it has kind of taken over when it comes to like the support that is available for autistic people, specifically autistic kids. When it comes to insurance, they often will not even consider other forms of therapeutic interventions or support. It is just ABA or nothing. And so a lot of people, even when they know that ABA can be harmful, or even when harmful ABA is being conducted in their home, or when they're taking their kid to ABA and their kid is coming home unhappy and upset, they're forced to continue doing it because it's the only option that insurance will cover. So the bottom line when it comes to ABA is that it can teach very necessary, very helpful, and very important life and safety skills, But there are a lot of critiques and concerns when it comes to ethics, the risk of teaching the person to engage in high levels of masking, reducing autistic traits, and the lack of adult outcome evidence. Now let's move on to cognitive behavioral therapy, or CBT. A quick overview of CBT, it's basically based in challenging irrational feelings, thoughts, or behaviors. It's often this process of taking an irrational thought and breaking it down to understand it so that you can challenge it and think more rationally. And I put quotes there because you'll see why soon. But the main issue that I personally see with CBT when it comes to autistic people is that many autistic thoughts and fears when it comes to maybe fearing social situations, fearing sensory situations, fearing that you're going to be misunderstood, fearing that people are not going to like you, fearing that you will not be able to tolerate the sensory environment that you're in. These are not irrational thoughts. These are thoughts that are based in very real life examples and situations that we've been through, things that can be traumatizing. And so to call it irrational and say that we need to challenge those thoughts to get through them is very dismissive and very invalidating and not helpful, because they're not irrational thoughts. And so calling them that and saying we need to challenge them is just trying to trick the person, really, because it's not actually the truth of what's happening. My main and the biggest critique that I have of CBT when it comes to helping autistic people, supporting autistic people in therapy, is that there is a mismatch in what the therapy does and what autistic people often need. We don't need to be told that our thoughts are irrational or that they are something we should challenge, because they're real. They have happened to us, and we're afraid of them happening again because they've happened before. If an autistic person is afraid of being disliked, it's probably because they've been disliked. If an autistic person is afraid of being misunderstood, it's probably because they've been misunderstood. If an autistic person doesn't want to engage socially because they've had a lot of negative social experiences, that's not irrational. That's a real thought based on real things that have really happened. So to challenge them by saying they're irrational and we need to break it down and find a more rational way of viewing the situation, it doesn't really make sense, because this is a rational view of the situation based on the evidence that we have from our lives. This makes me heated, you can probably tell, but I really don't like the idea of calling these fears irrational, because for a lot of us, they're very rational. Similar to ABA, certain ways of utilizing CBT can also lead to performance-related goals, especially in social situations, and this can again lead to encouraging camouflaging and masking, when really the goal should be to support the person to live authentically, autistically, safely, in a way that's affirming to them, rather than coming up with, oh, this is an irrational thought, let's challenge it this way, and then let's help you put on this fake persona so that you can engage in a way that other people enjoy. Often a lot of these therapies feel like that's the line of thought, and so you can see they're just not designed for autistic needs. Another big problem is that there is no one specific way outlined to adapt CBT for autistic people, and so this can lead to a lot of inconsistencies between therapists with how it's being administered, how it's being used to support autistic people, because it wasn't designed for us. So this is another issue. So the bottom line with CBT is that it can be helpful for certain co-occurring mental health conditions that would benefit from viewing the thoughts as irrational and challenging those things. But when it comes to autism, this line of thought is not helpful, because a lot of times autistic thoughts and fears are rooted in real life examples and things we've been through. Now let's move on to occupational therapy, or sensory-based therapy. This type of therapy focuses on daily living skills and sensory integration to support everyday things that the person might need to do, like brushing their teeth, sitting up in a chair, eating at a table, walking to a bus stop, all these different types of daily living things that a person might need to engage in that sensory-wise can be problematic or a struggle. Again, similar to ABA, one of the main critiques is that there's not a lot of research with how this therapy works for autistic adults. It specifically often looks at children, and so it's just not super accessible for adults to see how impactful or to see how in clinical trials it has worked for other adults, because a lot of research just focuses on kids once again. Another big problem with this is that for therapists administering this therapy, if they are trying to work with autistic adults, they may not know how to adapt it for adults, because a lot of the sensory supports and the therapy interventions that come with this type of therapy are designed for kids, and kids and adults need different things. We may need to be spoken to differently. We may need to have things integrated into our lives differently. It leaves it in the hands of the therapist to make the decision of how to do that. There's no guidelines on how to adapt it for adults because it's so largely used with children. Another thing is that this type of therapy is for sensory things and helping you navigate sensory life skills that you might need, but it's not really about the mind stuff. And so this is a type of therapy that is not necessarily going to be super helpful when it comes to actually talking or working through things that are happening internally. Overall, this therapy can be highly practical and useful, but we need a lot more research with how to adapt it for adults, and we also need something in addition. Just having the sensory stuff taken care of doesn't take care of all the other stuff that autistic people might need support with. Autistic people also have mental stuff going on that we may need support with. A lot of us have a lot of trauma. A lot of us have a lot of social phobias, things like that. And this type of therapy is not necessarily adaptable to helping in those areas. And now lastly, let's move on to DBT, or Dialectical Behavior Therapy. This is a skills-based therapy that combines some of the elements of CBT with mindfulness, distress tolerance, emotional regulation, and interpersonal skills. This therapy was originally designed specifically for people with borderline personality disorder, but it is very widely used for autistic adults, and I've heard anecdotally from a lot of autistic people that it's been quite helpful. But there are still some critiques because, again, it was not designed specifically for autistic adults. It was designed for people with BPD. One critique is that often with DBT, it's done in a group setting. It's also often very fast-paced because there's a curriculum that you have to get through in a certain amount of weeks usually. And this can lead to a lot of content being given to the people in the group or the person that's receiving DBT in a very short amount of time, which can be a little bit difficult for autistic people who may need more processing time. There can also be a sensory overload with group settings for some autistic people. And again, the sensory and processing needs of an autistic person may be quite different than someone who is not autistic. And so this just may not be a supportive environment or a way to receive therapy for autistic people. Being in a group setting where things are moving pretty fast, that is just not always the most helpful dynamic for an autistic person. Another critique of DBT is that it very heavily relies on pretty abstract wording. A big thing talked about in DBT is wise mind, which is a state of being where there's a balance between your emotional mind and your reasonable mind. And all of this is very abstract and kind of hard to explicitly talk about. And this is not always accessible for autistic people who may be literal thinkers and rely on very concrete terminology in order to translate these concepts into real life things that they can grasp and integrate into their daily living. So using abstract wording, which is often used in DBT, can be not super helpful for some autistics who may rely on concrete and literal wording in order to translate these things into real life concepts that they can utilize in their day-to-day life. Another issue with DBT is that there's a lot of emotional regulation reframing that happens with DBT, and this can sometimes pathologize or ignore the very real emotional and sensory triggers that a person may experience. It can sometimes feel like the reframing and the emotional regulation skills and tasks that you go through with DBT can feel like they are ignoring the realness of how deeply you are experiencing something. And emotional regulation struggles are a big part of borderline personality disorder as well. But the difference is that I think a lot of times with BPD, the goal is to lessen your BPD symptoms, but with autism, the goal is not always to lessen your autistic traits. So using emotional regulation tools that sometimes feel like they're minimizing the emotional expression you're having. And so because of this, it can sometimes feel like DBT is unnecessarily pathologizing autistic emotional expression rather than supporting your emotional expression. And again, as is the case with most of these other therapies that we've talked about, many DBT clinicians lack autism-specific training, which can make it difficult to adapt these concepts to being accessible for an autistic client. So that's a very brief overview of these 4 different therapies. Ultimately, a lot of them have child-centered origins and are not easily adaptable, / do not have guidelines for how to adapt them to an adult population. A lot of them have limited adult research. A lot of them involve a risk of encouraging masking or identity loss through encouraging camouflaging. And with some of them, there may be this pathologizing of traits that really don't need to be pathologized, but rather just supported. Ultimately, if you're seeking out therapy, some of the things that I think would be a good idea to look for in a therapist are a therapist that validates your realistic fears and doesn't try to dismiss them or challenge them because they're real. A therapist that does not aim to erase your autistic traits, but rather to support you in finding a way to navigate life as an autistic person in whatever way makes sense for you. A therapist that will adapt the pace, language, and the environment to be suitable and affirming for their client. A therapist that will help co-create the goals or the outcome that you're looking for because you are the client, you are the person coming to therapy. It should be your choice to figure out what you want from it. And lastly, a therapist that focuses on accommodations, not just pushing you to cope. And this, again, is a big thing with ABA, I'll just say right now, but accommodations, access tools, supporting the person, and using an approach that validates your experience in the world and doesn't try and change you for the world, but rather tries to change the world for you. And that means not always putting the responsibility on you to have to adapt and change yourself to make things suitable for everyone else, but rather someone who sees that you are also a valid human being who deserves accommodations. And so changing your environment or the people around you making adjustments is just as important as you making the adjustments that you make for them. And that's the double empathy problem, and that's a whole other thing. That could be a whole other episode. But ultimately, a therapist who wants to help you figure out accommodations and access tools rather than is just forcing you to cope and find ways to change yourself to better fit the situation that you're in. So that's everything that I have for you today. Thank you so much for listening. As always, the citations will be in the show notes if you want to check them out. And again, a quick reminder that I'm not a therapist, I'm not a professional, I am not an expert at interpreting research or giving that research out. And so please do your own research. Please know that I may have misspoken, I may have made mistakes in what I've said today, but I tried my best. And ultimately, my goal is to say that we need a therapeutic support designed specifically for autistic adults, and we also need better supports for children as well, because what we have is really lacking. So that's everything. Thank you again for listening. As always, remember, autistic adults exist. We deserve awareness, support, community, and acceptance, and I'm so grateful that you're here. I'll talk to you again very soon. Bye.